Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Thyroid function plays a crucial role in female fertility, and both hypothyroidism, which is called as underactive thyroid, and hyperthyroidism, which is known as overactive thyroid, can impact reproductive health. Let's look at how thyroid conditions can affect fertility in women and how medications can improve fertility. Hypothyroidism and female fertility. It can cause menstrual irregularities. It can lead to disruptions in menstrual cycles, causing irregular or absent periods. This can make it challenging to predict ovulation and properly time intercourse for conception. It can also lead to anovulation, which is a problem. An underactive thyroid can affect the hypothalamus and pituitary glands' ability to release hormones that regulate ovulation, such as follicle stimulating hormone, luteinizing hormone. This can result in anovulation, which is called as lack of release of egg. This also reduces the chance of conception. Hypothyroidism can also lead to luteal phase defect. Luteal phase defect is the second half of your menstrual cycle, and it is characterized by corpus luteum producing progesterone to support potential pregnancy. Corpus luteum is the follicle which has collapsed after the egg is released. This follicle, now known as corpus luteum, releases progesterone. Hypothyroidism can lead to luteal phase defect, where inadequate progesterone production can negatively affect the uterine lining's ability to support implantation. So it's very critical that hypothyroidism be addressed in such cases. Hypothyroidism can also lead to increased risk of miscarriage, particularly during the early stages of pregnancy due to its impact on uterine environment and hormone balance. Let's now look at hyperthyroidism and its effect on female fertility. This can also cause menstrual irregularities or even amenorrhea, which is absence of periods, which affects the timing of ovulation, making it very difficult for you to conceive naturally. It can lead to reduced fertility. An overactive thyroid can disrupt the delicate balance of reproductive hormones, including those that regulate ovulation. This disruption can lead to reduced fertility and difficulty in achieving pregnancy. It can also cause something called as thyroid storm. In several cases of hyperthyroidism, a thyroid storm, an extreme life-threatening condition, can occur. Thyroid storm can lead to disruptions in various body functions, including reproductive system. Thyroid medications act by supplementing or modifying thyroid hormone levels in the body to restore normal thyroid function. These medications are used to treat thyroid disorders such as hypothyroidism or hyperthyroidism. Let's see how these medications work. The primary medication used to treat hyperthyroidism is levothyroxine, a synthetic form of thyroid hormone thyroxine, which is also called as T4. Let's look at how levothyroxine works. It acts by replacing thyroid hormone. In case of hypothyroidism, the thyroid gland isn't producing enough thyroid hormone, particularly T4. Levothyroxine is taken orally, and it serves as a replacement for missing T4 hormone. It also acts by conversion to active form. Once levothyroxine is absorbed into the bloodstream, the body tissues and organs convert it to the active form, which is triiodothyroxine, also T3, which is the biologically active thyroid hormone. By providing the body with an adequate supply of T4, levothyroxine helps normalize thyroid hormone levels, which are essential for maintaining overall metabolism, energy production, and proper functioning of various body systems. It also helps in regular monitoring. Achieving the right dosage of levothyroxine is crucial. Patients usually start with a lower dose, which is gradually increased based on blood thyroid levels, which measure thyroid hormone levels. Regular monitoring ensures that thyroid hormone is maintained with the target range. Medications used to treat hyperthyroidism aim to reduce the production or release of excess thyroid hormones. Let's look at how thyroid medications work. They work by inhibiting thyroid hormone production. These medications work by interfering with the thyroid gland's ability to produce thyroid hormones. They inhibit the action of an enzyme called thyroid peroxidase, which is necessary for the synthesis of thyroid hormones. They act by blocking iodine uptake. These medications also help reduce the uptake of iodine by thyroid gland. Iodine is essential for the synthesis of thyroid hormones. So by limiting the iodine uptake, these medications further reduce the hormone production. They also act by slowing the release of thyroid hormones. In addition to inhibiting new hormone production, these medications can also slow down the release of thyroid hormones, which are stored within the thyroid gland. Regular monitoring also is very important, and these medications can be used to regulate the thyroid levels. It is important to note that the choice of medication and treatment may be based on your specific thyroid disorder, patient's age, medical history, and various other underlying issues. These medications play a very important role in managing thyroid disorders and restoring your thyroid balance, but they should be taken definitely under a physician's or a endocrinologist's guidance only, both in men and women. If you wish to understand more about this, please feel free to contact us. Thank you.
A lot of effort has gone into making this video. Please like and subscribe us. Thank you.